Hello and welcome to Ovarian Cancer Canada's session titled Ovarian Cancer 101. My name is Alison Ross and I am Director of Knowledge Mobilization here at Ovarian Cancer Canada. For many people, when diagnosed with ovarian cancer, they're dealing with shock, fear, confusion, and there's a good chance that, they've never met another person diagnosed with ovarian cancer. There may be a lot of unknowns for you and your loved ones. So in this session, we're going to be answering some of the most common questions people have when they're diagnosed with ovarian cancer. Okay, so first we're going to start off with a land acknowledgement. So I want to acknowledge that the Ovarian Cancer Canada community comes together from across Turtle Island on the lands that we now collectively call Canada. We recognize and respect that these are the traditional lands of many diverse First Nations, Inuit, and Métis communities. We commit to doing all we can to encourage the culturally safe care of all those affected by ovarian cancer and to use our unique position as a health charity to respond to the calls to action outlined in the Truth and Reconciliation Commission. Okay, so here are the questions that we're going to cover in today's session. So first, what is ovarian cancer? Second, why the late diagnosis? So you may have heard that it's very common for ovarian cancer to be diagnosed in advanced stages, and you're likely wondering how this can be. Third, how is ovarian cancer treated? What are the risk factors? And lastly, how can it be prevented? And at the end of this session, if you're left with, even more questions, please visit our website at ovariancanada.org, or you can send us an email at info@ovariancanada.org to be connected with a staff member for more information. So let's start off at the basics. So before defining ovarian cancer, we must first go back and get on the same page about what the word cancer means. And you may already know that cancer is actually an umbrella term that refers to many different diseases. And the thing that all cancers have in common is that they're characterized by abnormal cells that start to grow out of control. And the abnormal cells can then start to invade healthy tissue. So then ovarian cancer is also an umbrella term, and it also refers to a group of diseases. So there's more than one type of ovarian cancer, and I'm going to come back to this point on our next slide. But in general, ovarian cancers are cancers that start at or near the ovaries. And it's really important to emphasize the part where I said or near the ovaries, because the most common type of ovarian cancer actually starts in the fallopian tubes, not the ovaries. So, calling it ovarian cancer may actually feel a little bit like a misnomer. So again, I really just want to emphasize this point that there are many different types of ovarian cancers as shown here on this slide. Most people would understandably think that ovarian cancer refers to just one disease, but as you can see here, there are many, many different types. The most common type is called high-grade serous. It's circled here in red. On the last slide, I said that the most common type of ovarian cancer actually starts in the fallopian tubes, not the ovaries. So this is the type I was talking about. High-grade serous ovarian cancers starts at the fallopian tubes, and it's the most common type of ovarian cancer. Many people don't realize that there are different types. So if you don't already know what type you have, be sure to ask your oncology team, as these are all very distinct diseases. Now, there are a lot of terms in the ovarian cancer world that may be new to you. It can feel really like a whole new language, especially that last slide that shows all the different types. So to try to keep things as simple as possible, it may be helpful to remember that ovarian cancers are named after the cells that they originate in. So broadly, scientists classify ovarian cancers into 3 groups, and each of these groups are named based on the cells that the cancer is starting in. So we have epithelial ovarian cancers, germ cell ovarian cancers, and stromal cell ovarian cancers. So epithelial ovarian cancers start in the epithelial cells, and these are the cells that form kind of the outer layer of the ovaries and fallopian tubes. Then we have stromal cell ovarian cancers, and those are starting in these stromal cells, and these are the structural cells of the ovaries. They really hold the ovaries together. Sometimes scientists describe stromal cells as like the meat of the ovaries. And then lastly, we have those germ cell ovarian cancers. So they're starting in the germ cells, and these are the cells in the ovaries from which the eggs are formed. So each of these ovarian cancer groups are divided down further into many different types. So again, it's just very important to know which type of ovarian cancer you have. As you can see here, the most common type of ovarian cancers are the epithelial ovarian cancers. They account for actually 90% of all cases. Stromal and germ cell ovarian cancers are much less common, accounting for just 10% together. So now we're going to take a moment and look only at the epithelial ovarian cancers. So remembering that these are the ovarian cancers that originate in the cells that form that outer layer of the ovaries and fallopian tubes. You can see here that there are actually 5 different types of epithelial ovarian cancers. So we have high-grade serous, that most common type, clear cell, endometrioid, low-grade serous, and mucinous. So high-grade serous is that most common type, and as you can see here, is actually accounting for 70% of all epithelial ovarian cancers. So now looking even closer at the 5 types of epithelial ovarian cancers from the previous slide, you can see that these are all very distinct diseases. So you can see here on this table, they start in different places. They're related to different genetic mutations. They're diagnosed at different stages. And if they even look different underneath the microscope. So that's what you can see in the bottom row here with the purple pictures. That's what they look like underneath the microscope. And you can see they look like completely different diseases. So the key message I hope you can see I'm really trying to emphasize here is that there are so many different types of ovarian cancers. And even when looking at the same category of ovarian cancers, such as the epithelial ovarian cancers here, we're dealing with a group of very distinct diseases. So now that we have a good understanding of what ovarian cancer is, let's move on to our second question, which is why the late diagnosis? So you may already know that ovarian cancer tends to be diagnosed in advanced stages, and there are actually a combination of factors that lead to this. So first off, there is no screening test. So the pap test does not screen for ovarian cancer. This is a really common misunderstanding though. Screening tests in general, they help to identify people in the general healthy population who may have precancerous or early stage cancers before the symptoms actually appear. So unfortunately, the ovarian cancer scientists, the ovarian cancer science is just not there yet, but this is something that researchers around the world are really working on. Next, there's no diagnostic test. So this means that even if someone has symptoms and is worried that they may have ovarian cancer, there's no single test that their doctor can order to confirm ovarian cancer. So the only way that it can be definitively diagnosed is with biopsy. The next reason is that the symptoms are very vague and they're very common. And they're very non-specific. So for example, things like bloating and abdominal discomfort. So these symptoms are often explained by much more common and much less serious conditions. And so they don't really act as warning signs to a person that they may have ovarian cancer. And so we're going to talk more about symptoms on the next slide. And lastly, the most common type of ovarian cancer, which is high-grade serous ovarian cancer. So it spreads when the cells are very, very small, and therefore the person doesn't have any symptoms. So it's not like there's a big tumor, a big mass growing, but instead it's more like tiny grains of sand that are spreading through the body. These cells are actually so small that the current blood tests that we have and the imaging tests that we have, they're not sensitive enough to pick up something so small. So this is why screening and diagnosis is so difficult for ovarian cancer. So for these 4 reasons together, ovarian cancer, unfortunately, is typically diagnosed in advanced stages. As promised, we're going to look at the symptoms in a bit more detail. Now, if you've been diagnosed with ovarian cancer, you may have experienced one or more of these symptoms, but there's also a good chance that you didn't have any of these or that you had other symptoms entirely. So as I said in the previous slide, this is what makes diagnosis so difficult. Not everyone experiences symptoms or the same symptoms, and the symptoms that are most often experienced are extremely common, and they're most often explained by much more common conditions. So things like, things related to menstruation, menopause, or GI conditions. So given this challenge, it's important to remind people that they know their bodies best. So if they start to experience a symptom that is new to them, it's abnormal for them, and it persists for 3 weeks or more, then they should go speak to their doctor. And this includes symptoms that even aren't listed here on the slide. So as it says on the bottom, if there's a symptom that's new to them, it's frequent, and it persists for 3 weeks or more, go talk to your doctor and include ovarian cancer in that conversation. Okay, we're now going to move on to our next question for this session, which is how is ovarian cancer treated? Now, since we already know that there are many different types of ovarian cancers, there are also going to be different approaches to treatment. So your treatment plan will depend on many different factors. But in general, most ovarian cancer treatment is going to include a combination of these three things here on this slide. So we'll start with surgery. So there's surgical removal, or sometimes you'll hear it called debulking of the cancer. In most ovarian cancer surgeries, the surgical team will do a total hysterectomy and bilateral salpingo-oophorectomy, which is just a fancier way of saying the removal of the uterus, both fallopian tubes, and both ovaries. So the goal of the surgery is to remove as much of the cancer as possible, and ideally there should be no visible cancer left when the surgery is over. Next, we have chemotherapy. So there are many different types of chemotherapy protocols that can be used for ovarian cancer. So this is, again, going to depend on the type of ovarian cancer and the stage. The general goal of chemotherapy is to kill any remaining cancer cells that may have been missed during surgery. You'll notice here, though, that we have arrows over surgery and chemotherapy, and this is to show that sometimes these are done in reverse order, and the chemotherapy is actually done before the surgery. So this would be called neoadjuvant chemotherapy. And the goal of neoadjuvant chemo is to shrink the cancer as much as possible before surgery so that it's easier to remove during the surgery. Then usually chemo is done again after surgery, again with the goal of killing any remaining cancer cells. And then lastly, medications are typically used in an attempt to prevent or delay a recurrence of the cancer. And we're going to talk more about those medications on the next slide. So the medications given after chemotherapy are called maintenance medications, and these are medications that try to prevent or at least delay the cancer from coming back. Maintenance medications can be divided into two groups. So first here at the top, we have PARP inhibitors. PARP, P-A-R-P, is actually an acronym. It stands for poly-ADP ribose polymerase. So this is just, again, fancy words for an enzyme that repairs damaged DNA. So a PARP inhibitor inhibits or prevents a cancer cell from being able to repair itself, which then leads to the death of that cancer cell. So in Canada, there are two PARP inhibitors approved for use. They're called niraparib and olaparib. Their brand names are Zejula and Lynparza. The second group of maintenance medications here on the bottom of the slide are called angiogenesis inhibitors. So these medications are given by IV, and the goal is to prevent cancer cells from being able to make new blood vessels, which then leads to the cancer cell slowing in growth or the stoppage of the growth altogether. So in Canada, the angiogenesis inhibitor that's approved for use is called bevacizumab. The brand name is Bambevi. Now, which medication you're going to be prescribed, it's going to depend on the many different specifics of your case, so you're going to want to speak to your oncologist to learn more. Okay, so that's a general overview of treatment approaches for ovarian cancer, but remember there are many different factors that are going to determine your treatment plan, including the factors shown here on this slide. So the type of ovarian cancer and the stage of diagnosis, whether or not you have any genetic mutations, if this is the first time you've been diagnosed or if this is a recurrence of the cancer, your age and general health and other comorbidities, so other conditions that you might also have at the same time. Your region plays a role as well. So in Canada, healthcare is delivered provincially and territorially. So we do see some variations in care across the country. And even in different cancer centers and different oncologists, there's different styles and approaches to care. So we see variations across these factors as well. And then, of course, you as the patient should be at the center of your treatment plan. So your values and your preferences should be really a driving force behind the development of your treatment plan. Before we move on from talking about treatment, I want to flag just one of our educational resources because surgery and chemotherapy can, of course, be very hard on the body. So I want to highlight a book recently published by Ovarian Cancer Canada titled Understanding Ovarian Cancer, a Comprehensive Patient Guide. This book is completely free of charge. It's nearly 200 pages long, and it answers the most commonly asked questions about ovarian cancer and provides all kinds of information that will help you to know that you're receiving the best care possible and that you're provided with all the support that you need. One of the chapters is all about treatment and it includes a lot of information about the side effects of treatment and how to best manage them. So this will be an excellent resource for you while moving through treatment. So this book is available both in hard copy and digital form. You can get it in English or French. So you can order your free copy by scanning the QR code here on the slide, or you can go to ovariancanada.org/resources/support-resources. Okay, shifting gears now, we're going to talk about the risk factors for ovarian cancer. One of the most common questions we get from people with ovarian cancer is why? Why did I get ovarian cancer? Is it something that I did or didn't do that caused this? And there's no good or easy answer to this question. And in fact, the majority of ovarian cancer cases are considered completely random. There's nothing that a person does or doesn't do that caused ovarian cancer. So in short, there's no singular known cause of this disease. So anyone who's born without ovaries is at some risk of ovarian cancer. So the average person, if they're born with ovaries, they have a 1.4% chance of developing the disease in their lifetime. There are some people, however, who are at a greater risk than average of developing ovarian cancer. So here on this slide, we have some factors that increase risk. So we'll start with age. So risk for ovarian cancer does increase as a person ages. As we age, our cells just become more damaged and it makes it more likely for cancer to develop. So ovarian cancer is more commonly diagnosed between the ages of 50 to 79. I think the average age of diagnosis is about 63. There are some more rare types of ovarian cancer that are actually more common in younger women. So it's important that doctors don't dismiss someone of ovarian cancer based on their age alone. Next on the list, we have a family or personal history of certain cancers. So a person's risk is going to be higher if they have a family history of ovarian and related cancers. So breast cancer, prostate cancer, pancreatic, endometrial or uterine, or colorectal cancer. And this is on both the mother's and father's side of the family. So there's this really common misunderstanding that ovarian cancer can only be passed down from a mother, but the genetic mutations related to ovarian cancers can be passed down by both males and females and can be passed on to both males and females. So it's very important that people speak with their doctors about family history of all types of cancers on both sides of their family. Next, we have ethnicity. So some genetic mutations are just more common among certain ethnic groups. Therefore, people in those communities are at a greater risk for inheriting a genetic mutation related to ovarian cancer. So some examples of these ethnic communities include people of Ashkenazi Jewish, French Canadian, Icelandic, and Eastern European descent. And then lastly, we're going to talk about genetic mutations more explicitly. So genetic mutations happen when a gene is altered, and as a result, it's not working anymore as it should. So by inheriting certain genetic mutations, such as the BRCA mutations, that's going to increase a person's risk of ovarian cancer and other cancers as well. So the most common, well-known genetic mutation that most people are familiar with are the BRCA or the BRCA mutations. But as you can see on this slide, there are many lesser-known mutations that are also related to ovarian cancer. So when a person undergoes genetic testing to see if they've inherited a genetic mutation, it's really important that they're tested for this full panel of ovarian cancer risk genes. Okay, and now we're moving on to our very last question for today's session, which is how can ovarian cancer be prevented? Now, if you've already been diagnosed with ovarian cancer, this may feel less relevant to you, but we do get this question a lot as people want to make sure that others in their lives have the information they need to reduce their risk. And the good news is that there are effective ways to prevent ovarian cancer. So as this slide says, there are two broad categories of prevention. There's non-surgical and surgical. In other words, there are ways to prevent ovarian cancer with surgery, and there are ways to prevent ovarian cancer that don't involve surgery. And I'll provide an overview of these options on the next few slides. So let's start with how to prevent ovarian cancer without surgery. So to do this, a person can lower their number of lifetime ovulations. So scientists believe that ovulation, which is that time during the menstrual cycle when the egg is released, so scientists believe that this time may actually be related to ovarian cancer. So the theory here, it's called the incessant ovulation hypothesis. It suggests that ovulation is an acute inflammatory event, and that the more we ovulate, the greater our risk of ovarian cancer. So therefore, anything that pauses ovulation may actually reduce the risk of ovarian cancer. So this slide provides 3 examples of when a person stops ovulating. So when using the birth control pill, when pregnant, and when breastfeeding. So I want to take a moment just to focus on the birth control pill piece here on the slide. So studies have actually shown that when used for 5 years or more, 5 years or more, the birth control pill can reduce ovarian cancer risk by up to 50%. So it can cut it in half. And this long-term effect has been shown even after that person stopped taking the birth control pill. So it's a very effective way of lowering ovarian cancer risk. Now we're going to look at surgeries that can be done to prevent ovarian cancer. And as the slide says, there are two different types of surgeries that can be done for this purpose. So the type of surgery that a person gets will depend on whether or not they've inherited a genetic mutation related to ovarian cancer. If a person has not inherited a genetic mutation related to ovarian cancer, then they're considered average risk. Remember, average risk means that the person is at a 1.4% risk of developing the disease in their lifetime. But if a person has inherited a genetic mutation related to ovarian cancer, then they would be considered high risk. So their lifetime risk, it's going to depend on which genetic mutation they've inherited. So here in the bubble on the right side of the slide, I've included a list of genetic mutations related to ovarian cancer. So again, remember, when the person is undergoing genetic testing, it's really important that they're tested for this full panel of ovarian cancer risk genes. So let's start with surgery for people who are at average risk. So if the person does not have a genetic mutation related to ovarian cancer, they're considered average risk, and therefore they can have an opportunistic surgery, or the fancy word for this is an opportunistic salpingectomy. And salpingectomy just means the surgical removal of the fallopian tubes. So with this surgery, the ovaries are not removed. So this may sound a little counterintuitive as we're trying to prevent ovarian cancer here, but remember I said earlier that the most common type of ovarian cancer, high-grade serous, it actually starts in the fallopian tubes. So the benefit of only removing the fallopian tubes but leaving the ovaries is that this person does not go into surgical menopause. So this person would still get their period. So this is an opportunistic surgery. So what this means is that the person does not have the surgery just for the purpose of preventing ovarian cancer. All surgeries carry some inherent risks, so we don't want to do surgery if the risks are going to outweigh the benefits. So an opportunistic surgery like this is done when the person is already having pelvic surgery for another reason entirely, and then we just jump on the opportunity of this unrelated reason. So for example, let's say somebody wants to have their tubes tied for permanent contraception, or let's say a person is going to have a planned C-section, then they can consider having their fallopian tubes removed during that surgery to prevent ovarian cancer in the future. And the good news is opportunistic salpingectomies have proven to be extremely safe and effective in reducing ovarian cancer risk. Okay, and we're now going to look at surgery for people who are at high risk due to having inherited a mutation in an ovarian cancer risk gene. So these people are sometimes referred to as previvors, meaning that they are at an increased risk, but they've not actually been diagnosed with ovarian cancer. So a person at high risk could undergo a risk-reducing surgery that's called a risk-reducing salpingo-oophorectomy. So this surgery is different from the surgery that we talked about on the previous slide in two ways. First, it involves removing both the ovaries and the fallopian tubes. So this is a much more invasive, life-altering surgery as the person will go into surgical menopause overnight because their ovaries have been taken out. So for these surgeries, it's very, very important that the person receives appropriate follow-up care to help them to manage the effects of surgical menopause. Okay, it's also different from the surgery discussed on the previous slide because the surgery is done with the explicit purpose of reducing ovarian cancer risk. So it's not an opportunistic surgery. We're not jumping on the opportunity of another surgery. In this case, the benefits of reducing ovarian cancer risk for a person at high risk outweigh the inherent risks that come with all surgeries. Okay, so I know this is a lot of information in one short session. So this slide really summarizes all the key messages we've looked at. So first, there are many different types of ovarian cancer. Ovarian cancer is very hard to diagnose. Treatment usually involves some combination of surgery, chemo, and maintenance medications. Anyone born with ovaries is at some risk for ovarian cancer, and some people are at higher risk. And some positive news is that ovarian cancer can be prevented. So before we wrap up, I just want to be sure that everyone knows that we have many more resources available to you that provide information about ovarian cancer and support for you while you go through this experience. So to start, again, I want to highlight this book that was recently published by Ovarian Cancer Canada. It's called Understanding Ovarian Cancer, a Comprehensive Patient Guide. So I did mention this book earlier already when we were talking about treatment, but I want to highlight it again as it covers so much more than just treatment. So here on the slide, you can actually see the chapter titles. What is ovarian cancer? Why did I get it? How is it treated? Should I consider a clinical trial? What can I expect during my follow-up care? Who are the members of my healthcare team? How do I tell people that I have cancer? What supports are available to me? What does survivorship mean? What is an ovarian cancer recurrence? How is an ovarian cancer recurrence treated? And asking the tough questions. And we also include a really helpful glossary of terms in this book as well. So like I said earlier, this book is completely free of charge. It's just under 200 pages long, and it's going to answer those most commonly asked questions we get about ovarian cancer. So it's going to provide a lot of information for you to help you make sure that you're receiving the best care possible. And it's going to provide a lot of the support that you're going to need. So again, hard copy and digital versions are available, both English and French. So you can order by scanning this QR code, or you can go to ovariancanada.org/resources/support-resources. Okay, so just to finish up here, I want to highlight that there are so many other opportunities for information and support. We don't have the time and space to review it all here, but there are educational resources, webinars, and other education events, also communities that you can join. So to learn more, visit our website, ovariancanada.org, or you can send us an email at info@ovariancanada.org. If you're really not sure what it is you're looking for, maybe you're feeling a bit overwhelmed, we do offer one-on-one support calls with Ovarian Cancer Canada staff members. So during these calls, we can help answer questions that you might have, point you towards the support that you need, and just see how we can best help. So again, just to set up a call, reach out by email. Again, that's info@ovariancanada.org. Okay, thank you very much.